What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive for COVID, flu, RSV, or any other virus, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Wednesday edition of the Pandemic Update for Wednesday, March 13th, 2024. If you're new to my channel, this is where we do the daily pandemic update on COVID and any other virus that could be a health threat to you. Want to stay informed? Want to help keep others informed? Well, first off, subscribe to my channel down below to stay informed. To help keep others informed, there's two ways of doing that. One, you can share my videos, and two, if you like this content, give it a thumbs up by hitting that like button down below. The more people that hit that like button, the more YouTube is going to push these videos out through the algorithm, which is a good thing because we want to keep as many people healthy and safe as possible. Alrighty, not a terribly busy news day today, so this is not going to be a long pandemic update. But we do have a few news stories. We'll take a look at some other data, including today's air quality, and we'll also take a look at wastewater data. Alright, starting off today, we've been talking about whooping cough from time to time. It's been several weeks since we've mentioned it, maybe even over a month ago, but it's not only on the rise in the United States, it is now on the rise in southwest Idaho. And it says public health officials are urging pregnant women and those who come in contact with young children, including their families, to get vaccinated against this disease known as whooping cough. And this can cause illness, and yes, this can last and sometimes be called the 100-day cough. And I've heard a lot of people talk on, whether it be on social media, Facebook, Twitter, saying they know someone or they themselves have been coughing for weeks after weeks after weeks, and it's just not going away. Well, you know what? Whooping cough is out there, and let's be honest, whooping cough is a problem. All right, something else that's a problem. We keep talking about how COVID is dropping, and I'm going to go with two directions with this. First, it's going to be something else, and you'll understand here. First off, we keep talking about how COVID is dropping. While it is dropping amongst most people, the school-age children, there's still some problems with that. Children aged 5 through 17 years old, COVID hospitalizations are actually up a little bit. While other age groups are seeing a decline in hospitalizations, school-aged children's hospitalizations levels are back up to late December, early January levels. Why is this happening? They put. Due to transmission in classrooms and homes. And yes, this is continuing to be a big problem. And this is coming from Tact Now Info. You can see this chart here. Weekly rates of respiratory viruses associated with hospitalizations among age groups, and this is for kids, and you can see here, it is rising. So this is a problem, and something else that is a problem. We're going to take a pause for a moment here. Something else that is really a problem. Everyone's seeing, oh, the rates are dropping. Oh, yawn, winter waves are over with. You know, even when levels of COVID get low, guess what? You still run the risk of getting infected. You still need to wear these things. I don't care how low COVID goes. You still need to continue N95 masking. Because guess what? COVID hits us when we let our guard down. The second we let our guard down thinking, oh, things are getting better now. Everything's fine. The winter wave is over. Yeah, it went up, but now we're on the backside. It's dropping. Just because it's dropping doesn't mean that people stopped getting infected. People continue to get infected with COVID at all times of the year with this virus. COVID is not some seasonal virus that just happens in the winter, then it's over with. Last year, it dropped most of spring. Then what happened post 4th of July? We had a big wave that went up through the second half of the summer into the fall. It dropped, but it never fully dropped. Then we had the winter wave that came around. And we're still on the backside of this winter wave. And there's still a lot of people infected right now. Assume anyone you come in contact with that sounds sick or is coughing could be infected with COVID. Maybe it is they do have something else. But you know what? Do you actually have access to their test result that says, hey, they're negative for COVID? No, you don't have access to that. And guess what? Assume that they're positive for COVID. If they're coughing, they're saying they're not feeling well. Assume it could be COVID and assume it's a threat to you. continuing masking everywhere you go. All right, moving on, just one last news story. U.S. airport nasal swabs expanding to Chicago and Miami. Yeah, I don't know what this is all about. We're not going to read this whole story here, but CDC, and mainly this is for international travelers. It's to test international travelers. Why is the CDC is concerned about international travelers bringing in COVID or maybe bringing in new variants, but yet they're saying, oh no, you only need to isolate for 1 day. So they know COVID continues to be a major health threat to every living soul in this country and around the world, but yet they want to go get laid back on the guidance. But at the meantime, they're like, we really need to watch and see what's going on at the airports. Makes no sense. If you're that concerned, the COVID guidance should have never changed to what it is now. Alright, moving on. That does it for the news portion of our update today. Let's take a look at the latest air qualities around the United States. This should come up in a moment, and I'm expecting to see a lot of yellow in places that are in the warm weather right now. Yeah, yellow and orange, anywhere really east of the plains. Look at this. Wow, a lot of yellow and orange today, and I think this is going to be the case for the rest of the week, especially in the east. Look at South Carolina and Georgia. That seems to be where the worst air qualities are, though, take a look near Chicago. We're seeing some 100 values show up there. The Mid-Atlantic's not super great today. Yeah, it's just not a great air quality day. You have that southwest wind that I've been talking about, and it is bringing in the bad air qualities from Oklahoma and Texas, where wildfires continue to be an issue. The Rocky Mountains are not doing too bad, and the West Coast is not doing too bad at all today. Alright, continuing on. No need to show my other channel today. I was going to do something there today. I just haven't had the time to do it. Eventually, we'll get back to a climate or weather post at some point in time. All right, taking a look at the latest EMS totals for Philadelphia from yesterday. It was 726. Let's do a live look at what's going on in Montgomery County. Oh, this is not good. I've been seeing a lot of calls lately that have said cardiac arrest. Yes, and there's 2 right now that say cardiac arrest. There's stroke, multiple respiratory emergencies. This is Montgomery County, Pennsylvania. That, just so you know, it's a suburb just outside of Philadelphia. Literally, I live half a mile from Montgomery County, Pennsylvania. So that's not good to see. Chester County, Pennsylvania. Let's refresh this to make sure it's up to date. It is, and wow, it's busy in Chester County right now. Abdominal pain, seizures, sick person, heart problems, abdominal pain, heart problem, respiratory difficulty, fall, lift assist, stroke, sick person, hypertension, fall, lift assist. You get the idea. It's busy right now. Not a good thing to see. Walgreens. Yeah, let's show Walgreens. Not a whole lot of tests done at Walgreens this past week. 14.2% positivity, that's up 0.2%. Prior week was 14%. It's not up because cases are rising. It's up because testing is so low. I said this the other day, I'll say it again. Wouldn't surprise me if Walgreens stops reporting pretty soon just because of how low testing is getting. All right, let's take a look at some wastewater facilities. Let's start off with Boston today. Someone left me a comment stating that Boston was seeing a slight rise again for COVID. Sure enough, here on Wastewater Scan, ever so slightly. Nothing major, but ever so slightly. And I think we could see this going into the second half of March. I think that's where we're going to see a leveling of this dropping across much of the United States. In fact, Mike Horger just posted something today, or was it late last night, very late last night, showing that his model's projecting that things will actually bottom off, maybe end of March. I'll show it to you tomorrow. And that's possible in the United States just simply because I think there's going to be some increased transmission with what's going on with St. Patrick's Day. Like I said just a little bit ago, now's not the time to let your guard down. Oh, things are dropping, it's getting safer. No, 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 no. St. Patrick's Day's among us. We have seen in the past where St. Patrick's Day kicks off a spring wave. I don't know if that's going to happen this year, but just be prepared. If you're going to take part in any St. Patrick's Day festivity, I suspect there's going to be increased transmission in localized areas. We're not going to see the national level go upward. At least I don't think so. I could be wrong, but I think we could see some localized areas, areas that are just heavily Irish or take heavy participation in St. Patrick's Day. I think we are going to see some wastewater sites that show increases. It may already be starting in Boston. It may happen in college towns as well. A lot of colleges that are just returning from spring break have what's called syllabus, where students don't go to class for the week. They just skip their, oh, this is what your new class is going to be. Blah, blah. I'm skipping that. I'm going to party. Yeah, well, that partying is going to result in some transmission. So Boston, slightly up for COVID. RSV is down at this time. Still listed as high, though. Influenza A is lower. Influenza B is still it's rising a little bit at this time. Norovirus was dropping. Now it's showing a slight rise once again. No issues with Mpox and plenty of detections of hepatitis A. Is that even believable? Wow, that is a lot of hepatitis A detections at this time. Let's go a little bit further. So let's take a look at Delaware. We have not checked in with Seaford, Delaware in quite some time. What is going on there? Medium for COVID, ever so slight rise at this time. RSV, look at that. RSV is almost not an issue now. That is fantastic news. Influenza A is low at this time. It's saying high, but let's be honest, that is a low level at this time. Influenza B has rose slightly. HMPV, not much of an issue. Norovirus has flattened out at this time. Maybe it will start dropping. Hopefully it starts dropping. Hepatitis A, there are some detections, and no detections of Mpox at this time. Let's just do one more wastewater site. And let's see, where do we want to go here? Let's see what's going on in Memphis, Tennessee, shall we? In Memphis, Tennessee today, we can see levels for COVID have flattened out at this time. RSV is low at this time, almost not even an issue. Influenza A has dropped. Influenza B is rising ever so slightly. Norovirus is doing a slight rise at this time. No Mpox issue. And some hepatitis A issues at this time. Taking a look at wastewater across the United States, there are still some states that are in the very high category, such as Tennessee, Georgia, Kansas, Minnesota is high at this time, but not very high. How about Virginia? Virginia is still coming in very high as well, and the rest of the country is a general mix, with the West Coast not doing bad at all right now. Minimal in Oregon and Washington. You're doing really well for all the viruses, including RSV and influenza is doing well in your area at this time. Hospital capacity in the United States right now is at 77%. Of all beds being used. COVID-19 makes up 2.1% of that. Influenza is at 1.1%. And what's the ICU situation in the United States? 72.3% of all ICU beds are being used. 2.1% for COVID, 1.3% for influenza. All right, let's move on now. We can see here hospitalizations. This is deaths, and there are a couple states that are rising for deaths, Kentucky and Mississippi, and there may be a few more that are sprinkled in between, but for the most part, deaths in the past week, they didn't change much. They're actually flat week over week. Now taking a look at hospitalizations, 15,141. That's down by 13.6%, so that is good to see. We can see here, JN.1 is the dominating variant at 92.3%. We'll get an update on that on Friday. Taking a look now at New Jersey hospitalizations, and they continue to fall. 391 people in hospital, 68 out of 70 hospitals reporting. Yes, that number would likely be around 400 or so if all 70 hospitals reported. 19 people on a ventilator, 55 in the ICU. Discharges, 78 people have been discharged at this time. 453 people have tested positive in New York State in the last 24 hours. Taking a look now at hospitalizations in New York State, 781 and 87 people in the ICU. Now, drumroll please, has Colorado updated yet? Let's find out. I don't believe they have, but we'll see here, because nope, still no update out of Colorado. The most recent update was last week, where they had 128 people hospitalized, and yes, that was actually up slightly, and their cases were down. They had 1,319 cases last week. Hopefully tomorrow we'll have the update for Colorado. Alrighty, folks, that is it. That's all I have for today. It's getting slow. It's becoming slow news periods. I did make a statement yesterday that when the slow news periods comes, I won't stop these pandemic updates, but you know what? There may be a day here and there where we just may skip. In other words, not do anything until there's enough news to actually do an update. We'll see. I think we're going to keep this daily, but maybe once in a rare while that may happen. And eventually at some point, like I said, St. Patrick's Day is coming. That really becomes a big wild card. I don't think it's going to result in a massive wave, but again, it could cause some increased transmission, increased cases in localized areas. Not on the national level, but in localized areas, it could become problematic, especially in places that have big St. Patrick's Day celebrations. Alrighty, folks, I will see you all again tomorrow. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs to see these videos, which is basically anyone who could get infected with COVID, that's everybody. By all means, share this with anyone you know. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Wednesday evening. Thanks for watching.